Alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuhu. Sarah, how are you?
I'm great. How are you?
Alhamdulillah.
I can see at the moment you're at the hospital. Can you guess where I am?
I think you are in the hospital as well. I can see the hospital bed.
Yes, because I'm going to do a bronchoscopy.
Okay, well, I hope inshallah all goes well.
Thank you. Okay, so I was really confused and wondering. Like every single day, even when I'm not at the hospital, I always have to do my treatment like nebulizations, physiotherapy, and inhalers. I just don't understand like the sequence, because every time, like when I go to the hospital, sometimes the doctor say I have to do it 6 hourly now from now on. Like it's really confusing. I don't know the proper like sequence, because every time they just change my sequence, change my sequence, change my sequence. I'm really confused.
Okay, so if I go through the different types of inhalers and nebulizers and tell you the sequence, then it will make it easy for you to understand, and it will help lots of other people as well who will be watching your video later on, because we'll hopefully upload this video for the benefit of all the other children and families with cystic fibrosis. So what I want to say is that the nebulizers and inhalers and physiotherapies are all there to help people keep their chest clear and stop from the mucus building up in their lungs. So some of the treatments like the hypertonic saline and the nebulized antibiotics, they can make the chest tight, and therefore most people what they do, they start off with the nebulizer or the inhaler that opens up their lungs so they don't have that tightness when they have the other medications. So in the beginning, one should always take the bronchodilators, the medicines that open up the airways, and these are Ventolin or salbutamol inhaler, or albuterol as it's called in America, and that normally takes about 5 to 15 minutes, on average 10 minutes to work. So make sure that you take either the inhaler or the Ventolin in the form of salbutamol or Ventolin or albuterol at the beginning of anything before you do any physio or other medications. So once you've done that, you will then be protected from any tightening of your chest when you take the other medicines. Now, the other medicines, people take different sorts of medicines. Some take hypertonic saline to help them thin the mucus to bring it up. Others take pulmozyme, which also breaks down the mucus, but normally takes half an hour to 1 hour to work. So therefore, after the pulmozyme or DNAs, they have to wait about half an hour to 1 hour before they can do the physio. So take the Ventolin or salbutamol right at the beginning, followed by hypertonic saline or pulmozyme. And depending on whether you're taking pulmozyme, one has to wait for about an hour or so before one does the physio. Then do the physio, whichever technique is best for you and you are able to do, and that can be a cappella, or it can be aerobica, or it can be the vest, or it can be the percussion. Whichever physio you're doing, that is to clear the chest once the hypertonic or pulmozyme has thinned down the mucus, and get that out. After you've done your physio, then there are 2 other medicines that people normally take after the physio, and these are usually either inhaled steroids, and in Pakistan, Clenil is the commonest one used. And some people take it, not everybody needs it, but if you are taking it, you have to take that after the physio. And then at the end of all the other treatments, one should take the antibiotic nebulizers. And most antibiotic nebulizers, most antibiotics come in the nebulized form. There are some which do come in inhalers as well, but they are not available in Pakistan. So you should take your nebulized antibiotics right at the end of all the chest treatments. So if you can go through it again, first of all, you need to take the things that open up your airways, and that is salbutamol inhaler, Ventolin, or albuterol. Then followed by hypertonic saline or pulmozyme. Then do your physio, and after you've done your physio and clear the airways, then you can take the inhaled steroids if you take any, or take the antibiotics at the end of your treatment. And that should hopefully keep your chest nice and clear, inshallah.
Inshallah. Thank you.
Is that okay? Do you understand that?
Yes, I did.
Okay, I'm pleased that it will help you, and I hope it will help the other people as well. And I hope that you have your bronchoscopy in peace and it goes through all very well and you get all better very quickly and very soon, inshallah.
Thank you so much.
Okay, take care. Allah Hafiz.
Allah Hafiz.